Hi, everyone. Welcome to the first session of our World Bank and iRAP Helping Save Lives in Africa, BIGRS 2020 to 25 webinar series. We received over 1,000 registrations for this webinar series, not only from Africa, but from 111 countries all around the world. So many thanks for joining us for this webinar series. My name is Alessandra Fransoy. I am the Training and Accreditation Coordinator at iRAP, and I will be your moderator today. Just a few important notes about our session. Our webinar will have 90 minutes, including time for questions. All attendees are muted, but you are welcome to post your questions on our chat at any time during this presentation. You can see the questions tab on your screen. You have more or less the same image on your control panel. So please post your questions there. Our presenters will stop after their presentations and I'll read your questions to them. So this session is being recorded. I received a few emails asking from people that couldn't join the live session. So the videos will be available for you and the presentation files. We have more supporting materials as well. If you haven't registered on Schoology yet, please do. There you'll find other resources and also the videos and the presentation. You have an assignment as well for this session, for each session. You should have received the instructions about this on the webinar reminder email that you received an hour ago and yesterday. So if you have any issues, please send me an email and I will help you with that. So our webinar series has 4 parts, 4 days. Today we'll talk about the introduction to BIGRS and iRAP in Africa. On Friday, Greg will present the introduction to VIDA, and he will do a demonstration about how to do the analysis of star rating on VIDA. And on day 3, we'll go further on the iRAP model, explaining a few other features that we have. And on the last day, we'll present more case studies of projects in Africa and how to establish a iRAP program in your country, and also how to procure an iRAP project. So we have 4 amazing presenters today that will run this session for us. We have Alina Burlaco, the Senior Transport Specialist and Program Manager at BIGRS and Global Road Safety Facility at World Bank. Hi, Alina, how are you?
Hi, Ale. Hi, everyone. Thank you so much for chairing this webinar, and thank you so much for the participants for joining us today.
Thank you. And we have Arif Uddin, the Transport Specialist at Global Road Safety Facility, the World Bank. Hi, Arif. How are you?
Hi, Ali. Hi, everyone. I'm doing good. Warm welcome to the webinar series.
Thank you. And Rachel Nyanwa, the consultant for Global Road Safety Facility, the World Bank. Hi, Rachel. Can you?
Hi, Ali. Hi, everybody. Good to be here and good to interact with you on this webinar. I'm looking forward to it.
Thank you. And also we have Julio Urzua, the Strategic Projects Director at iRAP. Hi, Julio.
Hello, Ale.
Hola.
Hello. Thank you very much for the organization of this important seminar. Happy to be here.
Thanks to our presenters, to all 4 of you to present on this webinar series for us. And now we want to know more about our attendees. We'll have a poll. I will launch a poll here for you. And I would like you to answer this question. I think it will show on your screen soon. What type of organization do you work on? I think it's coming, probably. So if you can see, you can vote. I'll give you 1 minute. You can see any people from road safety engineering consultant or organization. In almost 10 seconds, we have lots of people from government as well, some from NGOs. I think I'll give another 10 seconds. We have 80% that voted. So just to see if everyone is ready. Okay. I think we'll see. I'll share the results that you see on your screen. Probably coming for you to see. We have 33% of our attendees. Can you see the results? 33% yes. Of our attendees are from road engineering. Thanks, Alina. Road engineering consultant organization, and after this we have government, we have road safety NGOs, other, and after you can post on the chat what is other, and we also have road safety NGOs with us. So many thanks, and we can go back and welcome everyone. We know we already have 340 people on this session. We look forward to have even more. We know that we have many registrations, so welcome. And for our webinar series agenda for today, we have this welcome and introductions, and Alina will present the Bloomberg Philanthropies Initiative for Global Road Safety for us at the next presentation. And we also have iRAP presenting setting road safety targets in World Bank projects. Julio will present the introduction to iRAP and the global context. And Rachel will conclude presenting to us the iRAP safety assessments in Africa region, summary of road safety assessments conducted so far. So after each presentation, we'll have time for questions. And on Schoology, as I said before, you have an assignment after about the content of this presentation. So now I will hand over to Alina to do your presentation.
Thank you, Ale. Can you see my screen?
Yes, we can.
With my full screen with my presentation, right?
Yes, perfect.
Okay, great. Thank you so much. Thank you, Ale. Hello, everyone, again, and really glad to have you joining our webinar. I will just briefly talk to you on a few slides, a bit on the GRSF background and the Bloomberg Philanthropies Initiative for Global Road Safety. So just as an introduction, first and foremost, the Global Road Safety Facility, the GRSF, is a global road safety fund hosted by the World Bank since 2006. And thanks to generosity of our donors, who are all recognized at the bottom of the slide, we managed to attract almost $74 million for a very, very diverse set of research, advisory, and capacity building projects. But at the same time, the GRSF is also a global knowledge and expertise center, which provided support to over 80 developing countries. Thanks to GRSF funded support to the developing countries and guidance to the World Bank funded investment projects, thousands of lives have been and will be saved in the next decade. but there is still a long way to go in cooperation with our global and regional partners. Reason why we have this webinar, and we're looking forward to a fruitful cooperation with you. Our attention is focused mainly on low and middle income countries, and our main type of engagements, they range from promoting strong regional and country level road safety leadership and influencing decision makers, also advising and promoting proven result-focused safety interventions among developing countries' professionals, to funding external partners in the research and knowledge exchange activities in low and middle income countries. In parallel, the GRSF provides regular support to World Bank teams in assuring safe solutions through World Bank loans funded projects, as Arif will also tell you a bit later in the same webinar today. And thanks to our donors, along with our support to Bloomberg Philanthropies Initiative for Global Road Safety, and also our multi-donor grant program, we are advancing our own research activities, which focus on the most efficient ways of addressing key road safety challenges of developing countries. And I'm very happy to share with you that in recognition of our efficient delivery of diverse road safety activity, the GRSF has won 3 prestigious Prince Michael Awards in 2020. But despite strong efforts focused on saving lives from road crashes, the reality is that road safety has been a silent pandemic, as over a 150 years period, it killed more than 60 million people. And the magnitude of this crisis is enormous, especially if we consider also the hundreds of millions injured over time. And as a road engineer myself, it is very sad to admit that road transport generates 97% of fatalities from all modes of transport, being the #1 leading cause of life lost for young people. At the same time, low and middle income countries suffer 93% of the road crash deaths and injuries. With an average rate of 27.5 deaths per 100,000 population, the risk of a road traffic death is more than 3 times higher in low-income countries than in high-income countries. These deaths and injuries increase poverty and reduce shared prosperity by driving families into economic hardship, and in many cases poverty, when the family's primary income earner is killed or suffers disability. In addition, crash deaths and injuries drain human capital and create costs which have been shown to significantly limit the economic growth of low and middle income countries. And this is one of the main reasons why road safety is a top priority for the World Bank also. The cost of this crisis is huge. And the 2017 World Bank report, The High Toll of Traffic Injuries, which you can see on your screen, and you also have a link to access it. This report noted that reducing road traffic injuries in half could translate into an additional 7 to 22% of GDP per capita income growth over 24 years. So when a government tells you the country is too poor to invest in road safety, the first immediate answer should be that the country is actually too poor not to invest in road safety. We really cannot afford not to put money into road safety and saving lives from future road crashes. Luckily, we have the Bloomberg Philanthropies, who was the biggest single donor in road safety and has already dedicated more than $259 million US over the past 12 years to implement life-saving interventions in low and middle-income countries and cities. Starting 2010, Bloomberg Philanthropies launched the Road Safety in 10 Countries program, which was followed by the Bloomberg Philanthropies Initiative for Global Road Safety, or BIGRS as it's called, for 2015-2019. It is estimated that these programs have saved 312,000 lives and prevented up to 11.5 million injuries. The good news is that in February 2020, the Bloomberg Philanthropies continued its engagement and launched its latest BIGRS phase, which is a $240 million US initiative that builds from the success and impact of the previous 2 programs in which World Bank GRSF was engaged in the past decade. The new phase of the BIGRS will run until 2025 and aims to save up to 600,000 lives and prevent up to 22 million injuries in low and middle income countries, focusing on 15 countries and 30 cities that you can see on your screen. In this new phase of the BIGRS 2020-2025, the World Bank GRSF is one of the 10 global partners and will focus mainly on national level work in selected countries. The team will engage governments in priority countries to support their efforts to adopt safer road infrastructure designs and improve existing road networks to accommodate all road users by conducting assessment of high-risk roads, providing recommendations for safety improvements, providing technical guidance on speed management, and supporting governments to adopt or improve crash data management systems. You can see also the 15 countries which are currently under the program in 2021 on the screen. One of the milestones for World Bank GRSF was to establish a speed management hub for the initiative, with the primary focus to provide technical expertise on speed management strategies to countries, cities, and Bloomberg Philanthropies partners, but also, of course, globally to whoever is interested, and help deploy countermeasures along risk-prone sections of the national and regional network to achieve a significant reduction in speed, and including analytical work related to the economics and benefits of speed management. So in February 2021, so just several months ago, we were able to launch an interactive speed management hub platform where the GRSF team provides evidence-based road safety knowledge to help manage speed through infrastructure interventions, effective enforcement, targeted awareness measures, and vehicle technology, among others. The Speed Management Hub also allows the wide dissemination of frequently asked questions, or FAQs, on speed management, together with a rich library, latest news, and best practices on this topic. And I strongly encourage you to follow the link on your screen for more information about our Speed Management Hub. In terms of global activities under the BIGRS, the World Bank GRSF has been working on a low speed zone guide, which was just launched a few weeks ago during the UN Global Road Safety Week, together with WRI, our partners. Also, we are working on a global speed management guide in coordination with WRI, and the first draft is already complete and was pre-launched during the UN Road Safety Week, and hopefully we'll be able to launch this later this year. We've also initiated our research on the economics and benefits of speed management, mainly a broader socioeconomic, looking into broader socioeconomic benefits of speed management will be studied with methodology for the research being developed right now. And we are also doing a technical analysis on speed management with activities ongoing in Vietnam, Argentina, Philippines, and Colombia. We do want to highlight the fact that speed is crucial in terms of road safety. And as you will see over the course of this webinar series, just a small variation of speed will have a huge impact in the lives saved. In terms of in-country activities, we've been working on the assessment of high-risk national road network and providing support implementation of improved infrastructure safety measures in selected priority countries. And this was done mainly by coupling efforts in countries where World Bank projects already exist, and also enhance project ownership and sustainability through well-structured capacity development for stakeholders, with a focus on strengthening competencies in infrastructure safety assessments, similar to what we're doing in this webinar series. Also, project planning and investment prioritization, pragmatic speed management practices, and data collection and management mechanisms. Just until in the past 1.5 years, we were able to assess over 1,000 kilometers of roads, and we have work ongoing in several countries in the program, with a strong engagement plan already in Ethiopia, Ghana, Uganda, that my colleague Arif is leading, and he will tell you more about this in just a few seconds. Also, in terms of capacity building, we were able to train over 4,500 people, and we are very happy to work with our colleagues from the International Road Assessment Program, with iRAP, to update the iRAP toolkit. So I'll stop here with my introduction for GRSF and the BIGRS, and I'll hand it over to Arif to continue with the slides on the BIGRS engagement in Africa. Arif, over to you.
Thank you, Elena. Ali, can you please go to the next slide? Perfect. So hello everyone again. I will start with our regional activities. So we had Essentials of Road Safety Engineering workshop last year, and we got a very good response from the participants in Africa region. So that particular workshop featured real-life black spots, road safety audits, and evidence-based approach to resolve infrastructural challenges considering road safety aspect. In total, we had 220 participants, and 97% of participants found it's highly useful. So in Ethiopia, we are having ongoing road safety assessments for 170-kilometer roads. We are doing iRAP baseline and design assessment, and we'll also review road safety audit. We hired a consultant to do this, and the activity has commenced. We reviewed 6 road safety audit manuals, which is developed under a World Bank Finance project with the Ministry of Transportation. And this manuals has road safety audit manual, manuals for speed calming, manual for road safety research, how to collect the crash data, etc. We also reviewed the design report of 500-kilometer trunk road. We recently completed 142-kilometer road safety audit of Meso-Deodawa road. And so far, via our Bloomberg program, we have 175 professionals who have been trained in road safety. So in Ghana, we just started the road safety assessments under one of the World Bank Finance project. We have 750-kilometer iRAP baseline and design assessment. We also plan to do school safety assessment for 50 schools, and we will review and update road safety audit manual. So under the World Bank Finance project, we have road accident database management system that will deal the nationwide crash database management, and GRSF supported by reviewing the pilot report and reviewing the term of reference prepared to hire the consultant. So far, 41 professionals trained via Bloomberg program. So in Uganda, we recently completed iRAP baseline and design assessment for 105-kilometer project roads. And we have planned to do road safety audit during construction stage for another 340-kilometer roads of another World Bank Finance project, and we will review the road safety audit. We also have road accident database management system activity under the World Bank Finance project in Uganda, and GRSF is supporting that activity also. So far, we have 55 colleagues who got training in road safety under Bloomberg program. So if you want to know more about our activities, please do visit these links that you see, and I believe you'll be happy to read what is our view in road safety. So please do visit the links and feel free to let us know your views or if you have any comments. Thank you so much. Until you have a question for us.
Thanks, Arif. Thanks, Alina. We have a couple of questions about the slides. First, I'll just repeat that the presentation will be available to everyone on Schoology after the session. And also they are asking if they could be included, Swaziland would like to be included in the project. They need capacity building and safety assessments. How does it work, Alina or Arif?
Thank you, Ale. Yes, I think this is one of the main questions that we are receiving when we do this webinars. So under the BIGRS, as I've mentioned a bit earlier, we have 15 countries that were selected, but these countries were selected by Bloomberg Philanthropies, who is our donor. So we don't have any say in the countries that are benefiting from support from Bloomberg Philanthropies. What I can suggest is to try to reach out to Bloomberg Philanthropies and contact them to see whether there is any potential in the future to to be part of the initiative. That's one of the suggestions. And you'll see in the slides that will be sharing with you, you'll also have the link from the Bloomberg Philanthropies from the initiative. And yeah, that would be my suggestion. We do have also from World Bank some engagements across Africa, as Arif was mentioning. So we are always trying to build on those existing engagements. Arif, not sure if you have if you have any knowledge on Swaziland, if you know of any road safety engagements or World Bank engagements that we can build on to assist.
Thank you, Elena, for the response. What I suggest to our colleague, please feel free to reach me. Since I'm based in Africa, share me the collaboration option and I can take it from there. I can check whether we have any projects or how to collaborate. So please feel free to reach me. Thank you.
Okay, great. We have other people from Uganda also asking which roads have been assessed there, because we have 100+ kilometers so far. I think Rachel will talk a little bit about this, but if you...
Sure, Rachel. So there's Koboyo Yambe Road. Rachel will talk a little bit more about this. So we have one of our World Bank project, that's Roads and Bridge project in refugee hosting districts, and that project actually particularly dealing that road in Uganda. So we just assessed that road based on iRAP approach.
Okay, thank you. And last question for now. They are asking if for speed measurement, do they use any sensor-based equipment?
It depends on the project. So our speed management hub, we provide research, we provided various studies, and depending on the country, depending on the engagement, we do different types of speed measurements. But it depends on the project and the budget available, and also it's really tricky right now because of COVID, because our international experts are not able to travel. So we work with what we've got. We've been also working with iRAP because we are also looking into leveraging artificial intelligence, and looking into big data to see how we can get some speed data for our assessments. So there are various options out there, and depending on the country and various other factors, we adapt. I think that's the main answer. Thank you.
Thank you. I think we will move on, and we have many questions already here on our chat, but I think some of them will respond during the presentations. If we don't respond, we can leave the answers also on Schoology. Thank you, Alina, and I think Arif will continue the presentation. Thanks, Alina, for your presentation.
Thanks so much, Ali. Hello, everyone. Again, in next couple of slides, I'll talk about global impact of road safety, how we address road safety in the World Bank projects, and I'll wrap up my presentation with a case study from Nepal. So question for you to tell us where this is and what's happening here. You'll get 30 seconds to think about it. So this is the picture from Copacabana Beach in Brazil, where Rolling Stones had one of the largest concerts in 2006. You might wonder why I'm showing the picture. Well, this is the slightly higher than we are losing people on road every single year. That's the number of deaths. I want to point out with this, around 50 million people are being injured every year. And this slide shows how 50 million might look like. So to talk to 1% from that 50 millions will illustrate more how damaging the issue is. This is Bridget from Ghana. who was hit by a car and the driver was drunk. Bridget is still suffering that injury and can't use sandal while going out. This is one of the 50 million stories which repeating everywhere in the world, up from Africa to Asia, everywhere. Road traffic injuries are the leading cause of death for the young group aged between 5 to 29. In terms of where we are, this is still 1.35 million deaths per year, 50 million injuries. Many of them are life-altering permanent injuries. Some of them are most productive members of the society and contribute to the economy significantly. So road crashes have a massive influence on the national income, which varies from country to country, but roughly we are losing 2 to 6% of GNP every year. The vast majority of the victims are poor and lives in low and middle income countries, which is around 93% of total global victims. Although those are gloomy news, we should be agreed that the first decade of action, which ended in 2020, raised awareness about road safety and provided us some evidence-based tools that lead us to the second decade of action, which started this year. By 2030, a very ambitious target of 50% fatality reduction has been set. A new action plan has been developed. I think the focus should be the need for strong political will, the need for good governance, the need to apply a safe system approach, and to find synergies between various road safety stakeholders. So the World Bank is the first multilateral development bank that has been taken dedicated action towards road safety. We have seen interest from other MDBs to follow our example. I think this is something as an institute should feel proud of, that we are setting an example to the world. The reason why we should be focusing on road safety, just looking at the transport global practice projects, we have 181 projects across the world which worth 38 billion USD investment. As I mentioned earlier, road crashes affect the poor mostly, and these are the countries where we work. So road safety is an utmost priority to our transport projects to ensure a safe and efficient transport system. In transport projects, we try to make sure road safety is addressed in other GP projects such as urban, health, agriculture, and education. So in 2008, the World Bank made road safety a pillar for its transport sector strategy and adopted the safe systems approach. In 2016, the World Bank adopted at least one road safety indicator in the result framework. In 2018, road safety screening and appraisal tool was introduced to rate the bank projects to measure road safety impacts for each project. The most important development for World Bank Safeguard has been the inclusion of road safety as a standard part of the environmental and social framework. In 2016, the World Bank adopted this new environmental and social framework to be implemented on new projects with concept notes prepared after October 1st, 2018. The important factors of environmental and social standard number 4 are that it identifies road safety risks during the project life cycle, conduct road safety assessment for each stage of the project, it implement viable mitigation measures, monitor project road safety, also procure safe vehicle, safe operation of construction equipment on public roads. So in short, road safety is measured as risk and a series of measures are suggested in ESS4. To ensure ESS4 is implemented at full capacity, our technical team, GRSF, and other experts in the World Bank were able to put good practice notes in road safety. It helps the World Bank team, especially the task team leaders, on how to support borrowers' effort to ensure road safety that is mandatory requirement of ESS4. You can see the download link, so please feel free to download and read further. So this is a recent document I suggest you to download and go through if you're not done yet. we apply safe system approach to all World Bank projects. As a matter of principle, as I said earlier, a safe system is vital to cut road deaths. The safe system approach is embedded and applied to all World Bank projects. Thanks to the good practice note. The bank's goal for road safety, particularly those called for in the ESF, will only be achieved through a holistic and systematic approach towards road safety, as embodied in the safe system approach. Colleagues who are not quite aware of safe system approach, it embraces a zero harm goal and places a strong emphasis on road builder, operator, and also vehicle manufacturer accountability for road safety performance. The genesis of this approach can be found in Swedish Vision Zero and Dutch Sustainable Safety strategies of 2 decades ago that set a long-term goal for the road system to be free of deaths and serious injuries. Basically, in a safe system, safe means safe, not particularly safe, such as in the well-accepted zero harm requirement for workplace safety. We all know that people will continue to make mistakes and crashes will still be happening. But at the same time, we need to make sure that the severity is less and nobody will not lose their lives when a road crash happens. As shown in the figure, it is recommended that road safety risks are addressed during the World Bank project preparation and implementation and the post-project operation phases, with the necessary foundational work laid during the preparation phase. Monitoring and reporting on road safety should be done throughout the implementation and ideally continue into the post-project operation phases. There are plenty of activities that can be delivered in different project stages. If you go a little bit back, please, yeah, perfect. As you see in some examples in all 3 stages. So for the sake of time, I will not go into details. You may wish to go through the GPN to know more. Next slide, please. I want to share some glimpse to the participant on what type of projects we apply road safety as apart from ESF. So that's to start with is type A project, which is transport projects with road construction or rehabilitation. For example, highways and rural roads. It can be urban transport projects like BRT, metro, or any project which leads to a new or changed road infrastructure, such as ports, railways, or aviation infrastructure. Type B, which we call other transport projects, for example, that has non-road infrastructure improvement related issues and non-transport projects which change speeds, traffic mix of volume, vulnerable road users such as pedestrians, bicyclists, and motorcyclists mix, volume, roads of facilities, etc. Examples may include policy changes on speed limit or vehicle import regulations, or the opening of a facility that draws trucks or pedestrians, etc. There are 2 more types in the World Bank. So type C is the construction only project with road safety impacts during construction only. For example, if we build a dam which will generate additional traffic, so we need to address road safety for that particular part. Type D is about vehicle procurements, projects with vehicle procurements as the only influence on road safety. So it could be fleets or even project vehicles. Mitigation measures should be adopted based on an evidence-based, data-driven approach in which the risks being addressed are the actual risk occurring or likely to occur. There are many potential non-infrastructure mitigation measures, and efforts are better directed at measures that have compelling evidence for delivering road safety benefits. Some popular mitigation measures have had mixed results and have been found to be less effective than commonly thought. So it's crucial to use the proven measures. In the GPN, a series of measures are recommended. And if you want to learn more about these measures, you may download the following guide: Road Safety Interventions, Evidence of What Works and What Doesn't Work. That's developed by the Global Road Safety Facility. Next, you'll see a case study from Nepal on how we apply road safety. So this story is from Nepal. That's road Safety Support Project, which was funded by FCDO, previously known as DFID, and supported by GRSF. You heard, Elena, that GRSF won 3 Prince Michael Award. This is one of the projects which actually got that award. Preceding this project, we had 750-kilometer road project in Nepal. Previous slide, please. Perfect. And it had significant improvement options considering road safety aspects. The project started in June 15 and completed within 2 years. So the project costed $7.5 million US. The project had 2 components. The first one was the capacity strengthening of the government in the implementation of Road Safety Action Plan, which was developed in 2013 with the help of World Bank project. The second component was improving the physical safety of that 750-kilometer road. Project objective was very simple. This is to reduce the risk of roadway departure crashes on selected sections of the roads targeted under the Road Sector Development Project and strengthen the government of Nepal's capacity to improve road safety. This is ample justification to have this project. There are 3 partners: FCDO, Department of Roads, and universities in Nepal and the US. GRSF helped throughout the project. So the project had 2 major indicators. One is the percentage of reduced risk of road departure crashes at dangerous location along selected project roads. The second one is strengthening capacity to implement Nepal's Road Safety Action Plan 2013. The team overachieved that target and just marginally below were achieved for the first indicator. So what's the lesson learned? First one is this is a standalone road safety operation. We found it is more targeted and the chance of objective is higher than any road safety components within a project. This was a simple project. One was related to strengthening government capacity and the second one is the infrastructure improvement. The implementation agency was Department of Roads, who worked with the World Bank for a long time. And this is very important to have good relationship between the partners. One of the things is soft components, why the governments can be less interested to implement. Having a good relationship with the government is vital to make sure soft components are also properly implemented. Prior preparation activities such as road safety audit are very important to achieve the target. In this particular project, road safety audit at the early stage of the project helped address the roads vulnerable sections. This helped the installation of crash barrier on the road. Last but not least, using the simple indicator can help to assess the project better. Monitoring and evaluation are very important in road safety. Here are some photos. You can see how mountainous the area is. In one of the photos, you will see the installation of the crash barrier. You can see the before after situation of the project. In the right, you can see the crash barrier protection, how it helps some of the vehicle moving off the road, especially in a mountainous area which is covered by snow. In 20 years, the project will save 3,500 lives, which has been an enormous achievement. With this, I will end my presentation until you have any questions. Thanks for your attention.
Thanks, Arif. We have many questions still about how to include countries in the project. So Alina already responded that you can contact the BIGRS, and the link is on her slides. And also we have a few questions here asking if iRAP is mainly focused on speed management and saving lives. Do the road will be economically viable if the speeds on the corridor is reduced, or cost of speed management elements are increased, as the viability mainly depends on VOC and VOT?
Ali, could you please repeat the question again?
I think it's asking if they reduce the speed, it will be viable economically on the corridor if it is the reduce or the cost of speed management. I think probably Greg will be able to answer this kind of question because he will be showing Vida what you can assess and test as well.
Yes, I think Greg will show that, but just to have a little response from my side, I think it's a trade-off between road capacity and safety. So whenever we manage the speed, we need to keep in mind that we are saving lives. So if we think about VOC or something like that, there is some increase, but at the same time, it will save life. I'm not sure, Elena, you want to add anything?
Thank you, Alice. Yes, actually, I would like to encourage the participants again to check our speed management hub again, because we actually have a list of myths. So we do have some, frequently asked questions in relation to speed, but we also have some myths. And some of the myths are actually, that, for example, by reducing speeds, then we will increase costs, which is actually not true. And I would strongly encourage you to take a look. And I'm sure Greg and Julio will give you more information about the relation between speed and the iRAP star ratings, which is also extremely, extremely important. But again, there are several myths around speed management, and I strongly encourage you to take a look. I'll put the link also in the chat so that you can quickly take a look and understand better what I'm saying. Thank you.
Thank you. Alina, while you are here as well, they are asking about driver, how they can access if it's still running.
Sure, yes, driver is up and running. We are actually preparing for launching driver 2.0. We've been working a lot on driver in the past couple of years. We have many pilots ongoing. iRAP is leading the work on driver in Africa. So we are currently trying to build on the pilots that we have ongoing, but we have also prepared a web page dedicated to driver, where we have an introduction tutorial on driver. So I'll put that also in the links for those interested to learn more in driver. And just to let you know that in the next, I think in September, most likely, we are planning a global webinar with the launch of driver 2.0 and also the launch of a global guide on undertaking road safety data reviews in countries. So just something to keep in mind. We'll get back to you with more information once we have a date set for that.
Okay, great. Just to
add with Elena, on next Friday, I think 9th July, our colleague Tawe will present our driver activities in Africa with the references and everything, what we're doing in Africa. So hope it will help also the participants who asked about and who is interested about driver.
Okay. So Arif, a question for you. Can you explain a little bit about the World Bank safety calculator?
Well, this is the application. I mean, we're developing an application by calculator that's by another of a colleague. What we're doing, we are putting some ratings for particular interventions, and then it will give you a good guidance about the whole improvement. And I'm not sure our participant asked about RSET that I mentioned.
Yeah, I cannot know, but maybe the person will answer here later.
All right, just to add, we have our tool, as you have seen in my presentation, we have RSET tool, where our task team is a high-level tool where we can assess the project safety impact due to the proposed intervention. So sometimes you'll see that if we follow the local road manuals, it have everything, and once we put everything, and then we can see that there is a good chance that the fatality will increase. So if we have that RSET tool, and if we provide the design indicators with some travel data and speed, then we can see how much life we can save in 20 years, and also what to do to improve the safety of that particular project using infrastructure measures.
Okay. We have many questions here that I think we will answer during our webinar series about iRAP methodology, how to assess roads. I think we'll answer that later on. And we have 2 more presentations. I think we can move on. Thanks a lot, Arif and Alina, for your presentations.
Thanks, Ali.
Congratulations on your project. And actually, Arif, your partner on the project in Nepal is attending here and he's saying congratulations on the project.
That's wonderful.
Okay, thank you very much. And now I will introduce Julio Urzura, who will talk about the introduction to iRAP. Julio, the screen and the mic is yours.
Thank you, Alessandra, and thank you for all the attendees to be here. And I am going to talk about the introduction to iRAP. So I know that there are already some questions from the audience about iRAP. So I think that in this introduction, we are going to be able to explain. So here I will start with this slide that is showing 2 pictures. The picture on the left, as you see, is a picture of a road, and then on the right we have also a picture of the road. However, the picture that is on the left, and as you see there in the green arrow, is 5 times higher in terms of the risk for the road user than the picture on the right. And this is basically because of the characteristics and the attributes of the infrastructure. Therefore, in iRAP, we say that the picture that is on the left is just 1 star, because in iRAP we rate the safety of the infrastructure in stars, ranging from 1 star, which is the least safe, to 5 stars, which is the best condition. So here you can see the differences between the 2 pictures. On the left, you don't have any shoulder, for example, and also the possibility of having a front crash on the left is much higher than on the right, because on the right you have a barrier that is dividing, right, the traffic. So the possibility of having an accident is much lower on the right picture. So we are going to be advancing on this concept of the star rating and the risk of the infrastructure. Next one. So why we are doing these assessments? Basically, the reason that this is important is because road safety is incredibly important today. Road crashes are the leading cause of death for young people, especially worldwide. This is a stunning statistic that many people are not aware of. So worldwide, for you to know, 300 and 500 people are killed in road crashes every day, and over 100,000 people suffer life-changing injuries daily. So between now and 2030, millions and millions of people are going to be killed and injured on the world's roads. The sort of injury that people suffer are really devastating. If you have the chance to talk to any doctor or any trauma surgeon, particularly in a developing country, this person is going to tell you that the situation is really serious. So there are amputation, quadriplegia, severe brain injury, burns, dislocations, etc. So these sort of crashes have a huge impact on a community and families. So this is the importance of attacking and the road and safety, especially on the infrastructure. Next one. So what is iRAP? iRAP is an acronym for International Road Assessment Program. iRAP is a not-for-profit organization. iRAP is not a company, is not a consultant company. We are a registered charity. We are registered in the UK, and we have a vision, which is a world free of high-risk roads. And we dedicate our time to inspect high-risk roads and develop basically two products. One is the star ratings, and the second one is the safer roads investment plans, as you see on the screen. So far, we have been working in more than 100 countries around the world, and we have more than 1 million kilometers assessed with our system. So iRAP, the work that we do, we don't do it alone, and we are very thankful of especially our program donors, which is mainly the FIA Foundation and also the GRSF, the Global Road Safety Facility, FedEx. We also work with technical partners such as the World Bank and the FIA, the Asian Development Bank, the Caribbean Development Bank, CAF, which is also an institution in Latin America, the Inter-American Development Bank, and others such as Australian Aid, Google, BHP Billiton, Millennium Corporation. We also have some centers of excellence and a global technical committee that are in different countries in the world, such as ARRB in Australia, the TRL in the UK, MIROS, the IMT, this is in Mexico, etc. So these are centers of excellence. They work with iRAP in order to look after our methodology and improve it year after year to make it every year better. We also have a program that is called Star Rating for Schools because we are conscious that the children that go, especially walking to the school, they deserve a safer infrastructure to go to school safe. So we have a program that is called Star Rating for Schools, and you can look for it if you are interested in our website. And finally, wanted to mention that we have some self-governing programs. These are programs that are established in a country, and they are self-governing, and they apply the iRAP methodology in the countries. So EuroRAP is for Europe, AusRAP in Australia, USRAP in the United States, KiwiRAP in New Zealand, ChinaRAP. In Brazil RAP, we recently, a couple of years ago, launched the Brazil RAP program, and we also have India RAP, South Africa RAP, Thai RAP, and MyRAP, which is in Malaysia. So our intention is that more and more countries can create their own programs. So if you are also interested in knowing how you can create your own program in your country, in our last session in the day 4, I am going to talk about how you can create your own program in your country. So as it was said before, the safe system, it's really important to understand how we can improve road safety. So at the center of how we think about road safety and how the model was developed is it's become known as the safe system, and this is possibly the leading philosophy about how to manage safety worldwide. The safe system has the foundations in similar philosophies such as the Vision Zero. Maybe you know about Vision Zero in Sweden, and also the Sustainable Safety in Netherlands. So the safe system really emphasizes the need for safer people, safer vehicles, safer roads, and also safer speeds. What essentially says the safe system is that you cannot achieve a completely safe system without focusing on each of those 4 elements. So the 4 elements are important if you want to have safety in your country or in your region. So we can build roads to be very safe, but we really need people to behave safely. We need them to be traveling in safer vehicles, and also we need them to be traveling at safe speeds. So this is the safe system and the interplay, right, between these 4 elements. It's important to consider. Next one. So I wanted to show this slide because it's really important that we understand that at the center of this understanding is the human being. It's ourselves, it's the people. And we have to understand that human beings, we have limitations, and that comes in two ways. One limitation is that we make mistakes. Human beings make mistakes. And the second element that is really important is that human beings are fragile. One of my favorite ways of dealing with this is to give a little thought experiment. So what we are going to do now is that if you might even like to maybe shut your eyes while you do this, and you imagine that you are a developer and you are building this fabulous building, as you see in the picture, and you say to the architect, you know, although I want to build this fabulous new building, I also want you to try to save money, and I want you to do it in a cheaper way. So the architect might tell you, okay, so what we are going to do is that on the balcony, the one that you are seeing on the screen, we are not going to build a handrail. We are just going to save money by not building this handrail that you see the woman there. So you can imagine if in a building, just for saving money, you don't build this handrail. It would be absolutely impossible, right? So we don't accept that in a building the safety features are not built. It's just unacceptable. Therefore, the question here is why we are not accepting that in a building like this, the builders, they do not build the safety features, but sometimes when it comes to road safety, sometimes we accept that the roads are built with no safety elements. Therefore, when we are talking about road safety and road infrastructure, we also have to demand from the authorities and from the engineering and from the industry that the roads are built with the same safety standards of for example, these buildings. Next one. So in iRAP, basically we do 4 products. It's star ratings, safer road investment plans, crash rate risk maps, and tracking performance over time. These are the 4 products that we do in iRAP, and we are going to be talking about the 4 of these soon. Next one. So I know that there was a question before about the safer road investment plan and the star rating process in iRAP. However, this is going to be going to be explained later by my colleague Morgan Fletcher, and I think that Greg Smith is also going to talk about this. However, just to give you a brief on how the system works, the system starts with a data collection on the road. And we do this data collection with a vehicle equipped with video and GPS coordinates, and then this data that is collected on the street, then on the desk we do a process that we call coding, which is the images, transforming them into alphanumeric codes every 100 meters. Then this package of data that we create and that it comes into a CVS file, this package of data, we mix this one with what we call supporting data, which is basically traffic flow and the vehicle operating speed at the 85th percentile. So with this package of data, we process this information into a software that belongs to iRAP that is called VIDA. This is for free. iRAP doesn't charge for the use of VIDA. And with this software, we create the star rating. We create the road conditions of the network that we are analyzing and the safer road investment plan. So basically, up to this point is the work of iRAP. But after this, it's very important that the authorities, they take the information from the software VIDA and they implement the countermeasures. Next one. So what is what we analyze? Basically, we pay attention into the attributes of the road. This is, for example, the lighting, the roadsides, intersections, delineation, pavement, geometry, footpaths, crossing, traffic mix, etc. These are part of the elements that we look when it comes to analyzing the road safety. Next one. So international evidence-based, what we wanted to explain here, that all the countermeasures that iRAP proposes, they are based on studies and they are based on international evidence base. For example, here I am showing a graph that it shows the relationship between the pedestrian safety and the number of traffic lanes in each direction. For example, when you have just one traffic lane, the risk of the pedestrian to cross the street is very low risk, therefore is going to be a 5-star. However, if you have 2 traffic lanes, the risk is going to be a little bit higher, therefore the risk is going to be higher and the star rating is going to be lower, and so on. When you have 3 traffic lanes, or when you have more than 4 traffic lanes, the risk is going to be much higher than when you have just one. As a matter of fact, for iRAP, having more than 4 lanes for a pedestrian to cross the street is going to be 8 times more risky than just having one traffic lane. Therefore, for iRAP, everything and every attribute that is on the infrastructure, it has a risk factor that we need to take into account when we do the analysis. Next one. So again, I think that also there was a comment about the relationship between, for example, the fatality risk and the operating speed. Again, the more speed there is, the operating speed, the more speed you have, the more risk of a fatal accident there is on the infrastructure, and they are different for the different road users. For example, for a pedestrian, at 10 kilometers per hour, the risk of dying on a run over is very low. However, when it comes to 40-50 kilometers per hour, is the risk of death on an accident between a car and a pedestrian, or a vehicle and a pedestrian, is almost 100%. And then the same analysis can be done for side impact, or a car against an object, or a head-on crash. Therefore, what our statistics they say, and I will go quickly on this one, especially because of the time. So we have done analysis around the world in thousands of kilometers, as I said before, and our statistics say something that we really need to take care about and pay attention. For example, 81% of the roads that have 80 kilometers per hour of operating, they are undivided roads. Therefore, the possibility of having a head-on crash is very high. Next one, Ale, please. That means that we have to work on providing safety features, such as, for example, safety barriers, because we know that safety barriers, they divide the traffic and they save lives. Next one. The same situation, for example, for pedestrians. 83% of the roads around the world that we have assessed, which 40 kilometers per hour of operating speeds or more, and with the presence of pedestrians, they have no formal sidewalks. Therefore, again, next one, we know that the sidewalks, they save lives, and we need to provide these safety features. Next one. So what we've done is, as I said before, star rate many countries around the world. As I said at the beginning, we've been working in more than 100 countries. And this is an interesting case of Mexico. As you see here, this is the star rating map of the Mexican network. In 2012, almost 10 years ago, we assessed more than 40,000 kilometers in Mexico. And then with this assessment and the investment plan, the authorities in Mexico, they applied a number of countermeasures to the infrastructure. And then 3 years later, we assessed it again in 2015. And the number of, or the percentage of roads that were 3 stars or better, they were lifted in 17%. Therefore, the network of the Mexican the roads, it was improved in quite a lot, in 17%. Next one. So here you can see like a very, very practical example of what I was talking before. This is in Mexico. This is a road that is called Querétaro-Irapuato, a length of 95 kilometers. And as you can see in the picture above, in 2012, this road, Querétaro-Irapuato, only 10% of it was 3 stars or better. Then you see exactly the same location on the picture below. And in 2015, 3 years later, 89% of the road was 3 star or better. And you can see also the condition of the road is very different, with an improvement on the shoulders and also a road safety barrier on the sides. But the most important thing is that 52% of the fatalities were reduced in these 3 years. Therefore, the road safety infrastructure has an impact on saving lives, as this example shows. I'm going to, next one, I'm going to give another example. This is one example from a really big country such as Mexico, and this is an example of a really small country such as Belize, a country that is in the Caribbean. So in Belize, half of Belize road deaths occurred in the past just on one road. So in this single road, 50% of the people that were dying in Belize were dying on that particular road. So we did targeted upgrades, which reduced the fatalities from 33 deaths per year to an average of just 8 fatalities. And we are going to see here some of the statistics. Next one, Ale, please. So here you see the authorities that they improved the conditions of that particular road. Next one. And if you see the statistics here on the table, you can see that in 2009, on this demonstration corridor, there were 33, unfortunately, people dying, and that was the 47% of the whole country. 4 years later, in 2013, you can see that in the country, the fatalities were bigger than before. From 70, they were 73. However, in the demonstrator corridor, they went from 33 to 8. So while in the country the fatalities were going up, in the demonstrator corridor they were going down. As you see in 2014, they unfortunately they went from 73 to 84, but in the demonstrator corridor just 9, and so on. So the impact of the improvements on this particular road was huge in Belize between 2009 and 2017. Next one. So the star ratings, the research, it shows that a person's risk of death or having a serious injury is approximately going to be half every time that you increment the star rating. So when you go from a road of 1-star road to the same road, improving it to a 2-star road, the possibility of having a death because of an accident on that road is going to be half. And then if you go from 2-star to 3-star, it's going to be half again, and so on until 5 stars. What in iRAP we encourage is that the countries and the authorities and the regions, they do have minimum 3 stars or better for all road users, because we know that we are going to be providing safer infrastructure and low level of risk of having an accident or a death. Next one, Alessandra, please. And I think that this is the last one. So some resources and information that I encourage you to look at. We have our website, irap.org. The software that I was mentioning before, VIDA, is vida.irap.org. And also a lot of data is on vaccinesforroads.org. There's a road safety toolkit that you might be interested in looking at. Is a depository of different types of accidents and good practices to improve the conditions. And as I said before, the star rating for schools is also a program that is quite new in iRAP. We are applying it every year in more and more countries, and it's in starratingforschools.org. Thank you so much for your attention.
Julio, thank you so much for your presentation. We have many questions here about iRAP methodology. I believe that we will answer some of them, but they are also asking here how to implement a RAP program in their country. And you do a presentation on the last day on that, right?
Yes, I am going to make a presentation specifically about how to build an iRAP program in your country. So this is also a motivation for the people to stay in this 4-day webinar until the end, because I'm going to be speaking about that. And I also wanted to say to the audience, sorry for there were some dogs barking here. All of us are at home now because of the COVID. So sorry for the inconvenience if it was a problem.
Thank you. Yeah, we could hear them. I hope you were safe with them. Thank you, Julio. We will move on, and we'll just ask another 10 minutes. We might go over 10 minutes on our presentations today. We still have one more presentation from Rachel, and it's very important, her part of the presentation. She's gonna present to us the iRAP assessments in Africa. Rachel, I will give you the mic, and the screen is yours. And I think also some of the questions that came during Julio's presentation will be answered by Rachel about the difference in the countries. So the screen is yours, Rachel.
Thank you, Ali. If you can move straight onto the first slide, because you did mention our lack of time. So thank you so much again. Thanks to the previous presenters. So just a very quick summary of what I'm going to talk about. I'll be giving you some information about what iRAP has been doing in Africa, what activities have been going on. If you look at the map in front of you of Africa, you can see that we've actually done quite a lot of work in the Eastern Africa, the eastern part of Africa, and West Africa, and of course South Africa. There's been quite a lot of projects. I believe so far within the iRAP database, there's approximately 17 to 20-ish thousand kilometers of roads which have been assessed. And the projects are ongoing. Like when you look at the map in front of us, you will see that the yellow dots are the projects which have been completed. And the red dots are the projects which are either ongoing or they're planned. Like there's some activities happening to start those projects soon. You will see that where the projects have taken place, there's actually ongoing work. In all the projects which we've started, there's always been like some activities happening after, whether it's implementation, whether it's additional assessments, whether it's some kind of risk analysis on the projects on the data that has been collected and shared. So there's a lot of activities happening in Africa. One of the strategies for iRAP is to actually, because like Julio mentioned, it's a charity and it's very lean. It's a very lean organization. There's not a huge number of team members within iRAP. So some of the key activities are ensuring that we can continue the good work that iRAP does. The methodology that that has been developed by the charity to help build capacity so other countries, other agencies, road development organizations or agencies can actually know how to do this work. And in doing that, iRAP is a very big supporter of capacity building, of teaching other people how to actually do these assessments themselves. So by doing that, there's this big push for developing national iRAP projects, national iRAP programs. And for example, South Africa has developed one, and I believe it's been around for a few years now, being coordinated under the RTMC. So South Africa RAP is up and running, and it's doing lots of assessments, especially in the eastern part of South Africa. They've even got like some accredited suppliers who are literally doing lots of iRAP work in that region, as well as the rest of the world. So another thing what we're doing, apart from the South Africa RAP, this big push for having regional or national programs has actually jogged a few countries, and a few of these countries like Morocco, Nigeria, Tanzania, and Tunisia are trying to develop the national RAP programs within their countries. Nigeria has actually launched a steering committee to look into how this RAP program can operate, so the various stakeholders that should be involved. In Tanzania, we have a project that we're working on with other people like PRC and the IRF, where it's called the Tanzania 10 Steps Project. And within that, one of the components is to help develop a national RAP program, so a Tanzania RAP program, so that Tanzanians can actually manage and coordinate their projects through this RAP process. We can go to the next slide, please. So considering the various projects that are going on around the country, I would like to focus this presentation into just the key things, the key attributes that affect risk and how we are rating. So what kind of star ratings are we receiving from the various road user groups or the various crash types that are known to be the biggest causes of either fatalities or serious injuries. And from this slide, you can see that when I look at the data that we have collected, when we look at the 11.3 thousand kilometers where people walk, where we have pedestrians, we find that where the speeds are above 40 kilometers per hour, so high speed roads where pedestrians are walking, 91% of those don't have footpaths, unfortunately, which means we're putting pedestrians, the highest risk group, at that much risk. So they're rating, 1 or 2 star. They're very high risk roads, so they don't have footpaths. We can go to the next one. If we look at the bicyclists, so that's I'm particularly focusing on the non-motorized transportation first, or the 4 road user groups. So with bicyclists, if we look at the kilometers of road that have been assessed using the iRAP methodology, and we look at the facilities that are available on roads where the speeds are more than 40 kilometers per hour, we find that 99%, so virtually none of the roads we've assessed have bicycle facilities, the roads that have high speeds. So we're exposing bicyclists to very, very high risks. To the next slide, please. The next one is about motorcyclists. Again, the third most at-risk group, motorized, but nonetheless vulnerable. So we have, again, we've assessed looking at the condition of the infrastructure, so the facilities that are available, and we found that along the roads where there's high motorcycle flows, so over 20% of the traffic flow is motorcycles. Sorry, traffic flows as motorcycles, and where the speeds are pretty high, so anything above 60 kilometers per hour. We found that none of those roads that have been assessed have any motorcycle facilities. We can go to the next one. And this is purely for Africa. This is just looking at the Africa data that has been collected over in the various projects. Head-on collisions are known to be one of the three key causes of fatalities and serious injuries. So when we look at the data and looking at the road infrastructure and how it's built and what facilities are available, we find that approximately half of those roads that have high speeds, so speeds above 80 kilometers per hour, don't actually have anything to separate. They're number one, they're undivided, so there's nothing to separate opposing flows of traffic. In addition, they're also single carriageways. So if there's opportunities for overtaking are limited, people will try, and of course the risks are higher because there's either poor visibility, narrow lanes, high speeds. And high speeds is actually one of those things that has a huge, huge impact on the outcome of a crash if it does happen. Go to the next one, please. So the next one is about runoff traffic. So this is where people lose control to the passenger side or the driver's side of the road. So we looked at the data. I looked at the data in BIDA on the iRAP system, and looking at the data we have 91% of the roads where there are curves, so where the sections which have sharp curves and at speeds of 80 kilometers or above, they actually have hazardous roadsides. So there's sections of road out there which have sharp curves, high speeds, and roadsides which are very hazardous, either cliffs, thick trees, or just dangerous places. And this is where people are most likely to lose control because of the fact that there are sharp curves and high speeds. And so when they do lose control, there's nothing to protect them from hitting a tree, for example, or going over the edge and going off a cliff. So these are some of the things. So 91% of the roads of these sections is actually quite a high percentage. We can go to the next one, please. And finally, just looking at the crashes at intersections. So we do find again that a lot of the roads, 87% of the roads that we've assessed, they have intersections where the traffic on the main road is the speeds are quite high. So you have an at-grade intersection trying to join a high-speed road. And when they're joining there, there's nothing to assist them to join safely. For example, there's nothing to slow down the traffic on the main. There's no roundabouts. There's no protected turn lanes for those that want to turn off the high-speed road onto a side road. So we have found that these interchanges actually are becoming locations of high risk, and crashes are happening at those particular places. And these are things that can be solved because if it's a junction, speeds of 60 kilometers per hour, there are things that we can do to prevent this. So we know how these roads rate. Sorry, next slide is fine. We do know how these roads rate. We do collect data. I mean, even countries actually collect data, but we find that when we look at the Africa roads, when we look at the data that we've collected so far, over 75% of these roads actually rating 1 star and 2 stars. So these are high risk roads. We need to work more. Partner with governments, help support them to try and figure out where these high risk locations are and see how we can fix them, how we can reduce. So we're considering all the risks that we have resulting from the factors that we've just looked at. If we can figure out where these locations are, we can start fixing some of these problems, start resolving some of the issues and minimizing or preventing crashes. You go to the next slide, please. So these crashes, what iRAP believes is that a lack of visibility of the true human impact of road crashes, it has created this a kind of empathy and underinvestment. So we don't understand the level of the risk, mostly because we don't have the right data or complete data. So we don't have this visibility. We can't see the challenges. We see them on a very micro level. So what iRAP is trying to do is shine this spotlight on the true impact of crashes. What's actually happening? What's when the crashes are happening, what's the real impact in people's lives and in our economy. And there is a online resource called Vaccines for Roads, where you can see how badly each country is doing, or how much fatalities and injuries and what kind of injuries are happening in each country, or even each region. So you can look at that on the Vaccines for Roads website. The link is there in the presentation. Please go to the next slide. Thank you. The next slide, please. So in essence, we know how people die. We know that we have collected some data despite how limited it is. We know how it's happening. So we just have to figure out how we can fix this. And the solutions are there. The solutions actually do exist. So it's not, I would dare to say it's not that complicated a situation. We just need to focus. We just need to prioritize these solutions. The SAFE system has actually been put in place to help us coordinate and collaborate better with every part of that system to help us improve and have really impactful and effective countermeasures. So where data is not readily available, we have things like the iRAP methodology, which helps us determine, like looking at the infrastructure specifically, how safe this infrastructure is, or how much it protects us when we make mistakes as road users. The iRAP methodology helps us identify the high-risk locations. So actually, with limited budgets and limited, or other competing resources or other competing priorities, we can focus our limited budgets on the key locations. So we can do an assessment of our network, find where the 1- and 2-star locations are, and actually prioritize those for development or for maintenance, focusing on what infrastructure is required. And the methodology also helps us to identify what countermeasures would be effective in each of those solutions. Go to the next slide, please. Just as the next slide loads up, Alina mentioned the Speed Hub, the World Bank Speed Hub, and we all know that the impact of speed is quite, it has a substantial effect on the types of crashes that we can have. We know that it's a huge contributor to the crash occurrence and the severity of the crash. So if we continue to speed or to drive really fast, then we have this interaction between vulnerable or non-motorized and motorized transportation. The impact is really, really visible and felt. So the Speed Hub gives us lots of opportunities to look at what can be done. Some of the myths Alina mentioned. We can look at there's a library of resources that can actually be very, very useful and impactful and can help us make decisions and help us, manage the challenges of speed that we're facing. And in conclusion, just in terms of iRAP enhancing road safety in Africa, this is the strategy that they're trying to work on. The first thing is, as we said before, we want to build capacity. iRAP is trying to build all the capacity to help governments be able to build safer roads, giving the right resources, the right information, the right countermeasure solutions to minimize risk on the roads that we are building as road development agencies. The next level after that is, of course, once we've developed this need for doing iRAP assessments, the next strategy for iRAP is to enhance the capacity for consultants and contractors. So once there is the market for doing iRAP assessments and focusing on safety, then there'll be a need for consultants and contractors to actually get the same capacity to be able to build safer roads. These two can work concurrently. But the idea is that we need to make it worthwhile, because we know that if there's no financial gain, the chances of actually contractors and consultants taking this on is a matter of personal wishes. So we try to encourage this more by encouraging road development agencies to actually have this need for private sector to get involved. From there, of course, we are aiming at having these national coordinated programs. So having an Africa RAP ultimately would be fantastic. Program would be the way to go. Once we have various national programs, for example, we talked about, having done a number of projects in Western Africa, we can actually have all these national programs get into like a collaborative kind of relationship or mechanism where they support each other through a regional program. So we can have, West Africa RAP, for example. And ultimately, we're hoping for an Africa RAP program. So having an Africa RAP program allows us to have wider support network for encouraging knowledge sharing, development of centers of excellence, for example, doing research that's actually a little bit more focused on the African challenges as well, having management across various global communities and coordination across various global communities, and of course having, and this would be working with regional and national leads. So everybody getting involved and trying to look for a solution that actually enhances our challenges in Africa. So this would be my strategy for how we can enhance iRAP in Africa. And with that, I would love to end there and hope that we get to speak about this again some more as the workshop continues. Thank you so much.
Thank you, Rachel. Very good presentation, very good research on that. And on the last session, you will present some of the case studies, right? And I think it will be a very good support for this presentation. We have many questions for you. I think you will answer some of the questions on your next presentation, but Ali is asking how to choose the best interventions when we have limited budget and prioritize projects.
Okay, so just to use iRAP as the example in this, so we know how much the countermeasures cost. We as road engineers and government agencies, we can determine how much like building a crash barrier per meter will cost and how long it will last. We can establish the impact of how many lives that crash barrier is likely to save, and we can establish statistically the statistical value of life. So what the iRAP methodology actually does, as it recommends a countermeasure, it does compare the statistical value of life to the value of the countermeasure. And the recommendations that come out of the iRAP methodology have to be cost effective. They have to be basically worth it to install. They have to be financially viable for them to be installed or recommended as part of a recommendation for a particular risk prevention method. So that's how the iRAP methodology works, and that's how we do understand that actually when there's limited funds, competing priorities, the road safety elements usually are the first ones taken out. We hope it's changing, but the reality is that's still the case. So we try to look for the most cost-effective recommendations and solutions to fix some of these problems, so that that excuse kind of comes out of the equation. I hope that answers the question.
Yes. Rachel, one more question. Actually, it came a few times during all the presentations. Johan is saying that he's missing the human factor. And in other questions, they are saying how much the human behavior influence this and why we are not mentioning that. Only the road infrastructure.
My personal answer is we definitely consider human behavior in everything. For example, the iRAP methodology, as you're collecting the data, you don't just, for example, if I give you an example of a footpath in Africa, we have markets which take over footpaths. When you're collecting data to determine what infrastructure is available on a section of road, if you find there's a footpath and it's actually being used as a footpath, you record it as a footpath. So within the model, it's like, okay, there's a facility for pedestrians. However, if that footpath is, for example, inundated with a market, or pedestrians are not using it for some reason, maybe the curb heights are too high or whatever, we record it as it's not a footpath because it's not doing the function of a footpath. The recommendation then might be that please install a footpath in this section because there's lots of pedestrians and there is no facility for them because the market has taken over, for example. And in that case, when the engineers go out there to build or to plan for this footpath or to engineer this footpath, they'll find it's there. And the solution may not be build a footpath, but actually make it usable. Do work with the accessibility to that footpath. So human interaction with the infrastructure is definitely a priority in all the attributes that we collect. And also we understand that when we're dealing with human behavior, I mean, we're all culprits. I am a culprit. When it comes to things like controlling or managing the way I behave, I may not be as responsive to your recommendations, even if they're good for me. However, the infrastructure doesn't talk back. If you say this footpath must be, 2 meters wide, you build it at 2 meters wide. The footpath can't say, no, I'll be 1 meter wide. So, it's easier to actually fix the infrastructure than it is to fix me, in my personal opinion. Thank you.
Thank you, Rachel. Many questions about Africa RAP and then specific countries. I think we will talk more about this. Also, people asking who are the suppliers, the accredited suppliers in Africa. We will talk about the accreditation on the last session, and you can find the full list on our website about the suppliers. And yes, many questions, amazing contribution and participation of the attendees. I think we are heading to the conclusion today, and I just want here to wrap up with some of the outcomes of these presentations. I think Arif and Alina presented the GRSF's activities under Bloomberg Philanthropies Initiative for Global Road Safety 2020-20. I just need the cameras here. And how World Bank is addressing road safety in their projects successfully via following ESS4 and good practice note. We also saw the global context and the impact of the road crashes, deaths, and severe injuries, the safe system concept and the need for safer roads. Also, Julio presented how iRAP works and the star rating model. And in conclusion, Rachel brought to us that over 15,000 kilometers of road have been assessed in Africa, with the majority being Eastern, Western, and Southern Africa. In a sense, African roads assessed rate over 75% of travel being on high risk 1-star and 2-star roads. So Rachel showed us that through the iRAP methodology, we can readily identify where the highest risks are, as she emphasized in the end. She says, armed with this information, we are able to systematically prioritize the improvements of our road infrastructure along these high-risk roads. So very good presentations, many people commenting how useful, how important the presentations were. So these presentations and the video of this session will be available to you on an online course. There we have a chat. Please comment on our chat. I'll post the answers to your questions there as well. Just go to www.schoology.com, create your account, please student account, and use this access code. This information is also on your reminder email with the instructions and more detailed instructions on how to do that. This course will be open to you until 30th July, and you receive a certificate upon completion of all activities. We already have an assignment to you there, 10 questions about the content of today's session. Very easy. We'll see how it goes, and I'm sure by the questions we can tell that you all got the message. And for Friday, our next session, we'll have Tauya Adoashon from World Bank presenting road safety in Africa, World Bank perspective. So we'll talk more about these assessments and the projects there in Africa. And Greg will present how to access and explore results in VIDA. So many people asking questions about this. You have a demonstration with Greg about it. Greg Smith from iRAP. We'll also have time for questions, and the practice, the assignment will be to use the demonstrator on our online software VIDA. And again, very important, your feedback. I want to thank also for your contributions and expectations that you completed on the registration form. We consider what you said on the registration form about the topics and the reasons you are attending these sessions. So as well as with your feedback now, please stay on the line and complete an evaluation form about this webinar session. Once we end the session, there will be a pop-up screen with the form. So please give us your feedback. And finally, apologies we went over, but I think it was worth to see all the presentations. Thanks everyone for attending our first session of the World Bank and iRAP Helping Save Lives in Africa webinar series. Thanks for your participation on our chat, many questions and very interesting contributions as well. And also big thanks to our presenters for taking the time to be here today. If you want to say your final words.
Thank you so much, Ale. Thank you everyone for joining us today. And I hope we'll have very fruitful webinar sessions later this week and next week. Also, thank you so much and really happy to have you.
Thank you, Alessandra, for the organization, and see you soon to everyone.
Thanks, Ali. It's wonderful to be here, participant from more than 100 countries. Wonderful. It's an absolute pleasure and honor. See you soon.
Rachel, we cannot hear you.
Apologies. Yeah, I was just saying thank you to everyone for joining, and we look forward to seeing you throughout the week. It's going to get more technical and a little bit more interesting. So thank you so much for all the questions as well. They're very, very interesting. Thank you.
Thank you. And we look forward to seeing you all on Friday. Bye. Thank you.
Stay safe. Bye.
Bye.